now with our health correspondent Nicola Hill, who joins us from London. Hi Nicola, firstly, what do we know about how ventilation can actually spread diseases like COVID-19 in an enclosed environment like offices?
Yeah, it's a really good question, that, Oscar. And basically, it's the poor ventilation that can spread it. If you've got effective ventilation, then that's okay. And that's a very important difference. So we know that the virus is airborne. We know that the big droplets fall to the ground in about a 1 to 2 metre distance, which is why we have this social distancing. But these smaller, these aerosol particles of the virus, tiny particles, spread much further, and they hang around in the air for a long time. And if you have poor ventilation and they're just recirculating the same air, if somebody who is infected asymptomatically breathes out these tiny particles, the ventilation recirculates the same air, so everybody else in that building, even though they could be quite a distance away from them, is going to breathe in that infected air. And that's why these scientists have written this piece in Science magazine saying, you know, something needs to be done, it needs to be improved, and we need to make changes to the ventilation in many of the buildings, not just offices, in schools, in theatres, in cinemas, and in restaurants. Professor Cathy Noakes, who's one of the authors of this study, sort of said, you know, the evidence was there a year ago why it's important to do this inside buildings, because you had 60 members of a choir, one person was infected, and therefore 51 members of that same choir also then got COVID-19. And that's why better ventilation needs to be put in place.
Yes, that is a significant problem, isn't it? Because for most buildings, offices, homes, schools, as you say, rely on air conditioning as the primary source of ventilation. So it would suggest that those current systems are really quite a danger to our health. So what does this article in the Science Journal say we should do? How should these offices and other buildings be designed in terms of improving circulation?
With better systems, really. I was talking to Dr. Simon Clark this morning from Reading University, and as you just said there, Oscar, a lot of these air conditionings work on a heat exchange system. So they'll take in the hot air, they'll cool it down, and then they'll send out cold air. What's needed, and what we have in the hospitals, for example, is a much more sophisticated system that brings in fresh air from outside. So the air that might have these pathogens in goes outside, fresh air is brought in, and that's what's circulated around. Now, a lot of gyms, for example, are now saying that they're doing this. We know many of the aeroplanes are saying that 98% of the air that they're bringing into planes is fresh air to reduce the amount. Otherwise, having really good filter systems and changing those filter systems. Of course, the main thing that most of us can do is open a window, but if you're in a hotel room that many of us stay in with sealed windows, you can't do that. So Professor Noakes says one very simple thing that you can do for yourself is if you go into a room that's smelly, that's musty, you know that there's no fresh air being circulated in that, so changes need to be made. But the other thing you can do is get a carbon monoxide monitor and basically measure the amount of carbon monoxide in a room, and if it's less than 1,000 parts per million, then that's fine. It means that it's probably being circulated, you've got fresh air coming in. If it's more than 1,500 parts per million, then that's a worry. And I have to say, my tap dance instructor brings that to the dance hall when she does teaches any dance classes, and she keeps a very close eye on carbon monoxide because she knows that that means there's enough fresh air in the room.
Okay, good to know. Nicola Hill, our health correspondent, thank you so much for shedding some light on that issue for us.